Good afternoon. I'm Chris Booth. I'm the UK Health Specialist for Perceptive Software. So at the moment, medical records or medical case notes are usually found residing in paper case files. And they can be quite large and can contain multiples of hundreds of pages per file. What we do is we take that content, that paper, it'll be scanned into, digitized in effect and put through a scanning process. And then that is represented into an electronic format which enables the doctor, the clinician, to view the same content via a PC. The other thing that's important is that we put that into context with the host application. So the patient's data will reside on a system, on a database system. And to take that content that we've digitized and put it into context with that system makes it all the more powerful and therefore more easy to use and therefore easier to treat the patient. Perceptive Software, through our ImageNow application, has a tool called Learn Mode, multifaceted. It uses some very unique tools to integrate at the desktop level, therefore making the integration very easy to do, and it's not a technical process. Once done, it's intrinsically linked, and therefore the organisation can be assured that they're going to get the right information coming back in context when they click that single click button and they retrieve that information. What we see on the screen at the moment is this is what we would call a typical electronic patient record system or patient administration system. It's a dummy. This isn't ours. We've just mocked this up for the purpose of the demonstration. And we can see here some elements of patient information, so patient's name, relevant number, in this case NHS national insurance number, admission date, etc., etc. One of the unique points about ImageNow is what we call single click retrieval. So down here in the bottom right hand corner you'll see what looks like a little gold sun. I'm going to simply make one click on this button here. What that does is it's going away now to add to the database, and set against a certain search criteria it will bring back the information against the patient. You can see we've just got Jeremy Bates's information here, but also based on the role, i.e. my role, what are my permissions to do this? So if I'm not supposed to see some of this information, I won't be able to gain access to it. What's come back in this case actually is that we've got 4 different sets of notes. However, all these 4 separate lines are all held within the main medical record, which is this line here. The other 3, the clinic notes, these are all subsets, and I'll show you how that works in a second. So if we quickly go to the medical record, again, double click on there, what this does is launches me the view, I referred earlier to the case notes, a view that replicates electronically the case notes. Now if we had a paper case note here, now what we would find is there would be sections of correspondence, clinical notes, nursing, etc., etc. Down here we've got some diagnostic information. What this brings back is a series of different documents that have been associated with this particular section. And when they were scanned in and when we first acquired this information, we would have given them some data to apply to make sure they went into the right place. So that could have been some automated process such as OCR, or we could have manually applied some rules to actually get them into the right place. And we can see here we've got a range of documents. If I was a clinician now, I'd be flicking through the paper case note. I can just simply step through now, and we see all different types of images, different types of content, graphs, ECGs, a range of different documents that have been scanned in under that heading. And that's how easy it is to get to that information. The integration piece is unique, truly unique, and the ability to take any system. I mean, at the moment we're looking against setting medical images, medical patient case notes against a medical-based system. This could be accounts payable. This could be human resources, and we teach it in the same way. So learning this application very quickly, putting the customer into a place where they could be self-sufficient, so they don't have to come back to us for lots of consultancy services. They can actually begin to own this from day one, and therefore it keeps the cost of the solution down. So when we looked earlier, we saw how when we pulled up a record, we were looking at what we call a document view. Now those views are configured within the system, and again the user can do those, even down to departmental level. And that's before we start thinking about things like workflow, which many systems will claim to have. But when you combine all of those into one package, simple integration, workflow, billing out the views in one solution, then you've really it's all there in one system out of the box. No bespoke development to be done, it's just configured to the way the user needs to use it, and quickly.